going to take a look at blood plasma, the straw-colored liquid part of blood. Blood plasma is a straw-colored liquid component of blood that normally holds the blood cells in whole blood in suspension. It makes up about 55% of the body's total blood volume, and at first glance it looks like not much more than just water, but nothing could be further from the truth. Blood plasma contains about 90% water, but in addition, inorganic ions, nutrients, vitamins, metabolic wastes, hormones, plasma proteins, among other things. Take a look at the picture on the left. The tube on the left, the red one, is filled with whole blood that has not been centrifuged. Right next to it is a tube that has been centrifuged, and you can see the top yellow, which is the blood plasma or serum, and the bottom, which are the packed cells, mainly red cells, and in between a sort of a buffy layer called the buffy coat, which contains platelets and white blood cells. Because some of the components of blood plasma have a short shelf life, often blood plasma is frozen after donation. There are three important groups of plasma proteins. They are the albumins, which make up about 60%. They act as blood buffers and contribute to high blood osmolarity. The globulins, which make up about 36%, and they are primarily antibodies, and fibrinogen, which composes about 4%, and they are important clotting proteins. We're going to take a look at blood clotting, also known as hemostasis and coagulation. It's a process that causes bleeding to stop, meaning it keeps blood within the damaged blood vessel. It's the opposite of hemorrhage. There are three important stages of blood clotting. They are vascular spasm, platelet plug formation, and fibrin clot formation, also known as coagulation. Let's look at the first stage of blood clotting, known as vascular spasm. First thing that will happen is there'll be some sort of damage to the blood vessel wall. When the wall is damaged, the smooth muscle that's in it will contract, and this leads to vasoconstriction or narrowing of the vessel. This should lead to a decrease in blood loss. An interesting fact to note is that a sharp cut is not nearly as effective at initiating vascular spasm as a crushing injury. During the second stage of blood clotting, platelet plug formation, again, it's initiated by damage to the vessel wall. When damage occurs, negative charges on the collagen in the vessel wall are exposed. Platelets tend to stick to these negative charges, and this activates them. The activated platelets then degranulate and release ADP. ADP then causes other platelets to stick and to degranulate, and the platelet plug blocks blood loss. This picture shows you platelet plug formation. There's a short video that you may want to watch that covers this as well. Again, as with vascular spasm and platelet plug formation, the third stage, coagulation, begins with damage to the vessel. When this occurs, inactive plasma proteins are converted to a prothrombin activator. This prothrombin activator changes prothrombin, which is inactive, into thrombin, which is active. Thrombin then causes the conversion of fibrinogen, which is inactive and soluble, to fibrin, which is active and insoluble. Fibrin then forms a mesh network around the platelet plug and holds it in place. And this is an effective method to stop blood loss. This is an electron micrograph of the clotting process. We've been talking about hemostasis, or stopping the flow of blood. We're going to now look at two bleeding disorders, thrombocytopenia and hemophilia. Thrombocytopenia is a clotting disorder, and specifically it's a platelet deficiency, so platelet plugs are unable to form. The normal platelet count is about 150,000 to 300,000. If a person has a platelet count under 50,000, it is diagnostic for thrombocytopenia. Symptoms of thrombocytopenia include petechiae, which are small red spots on the skin caused by bleeding into the skin. They're most commonly located on the legs. Prolonged bleeding from any site in the body, bleeding from the gums or nose, and blood in the urine or stools are all symptoms of thrombocytopenia. These petechiae are sometimes located on the conjunctiva, which is the mucous membrane that covers the front of the eye and lines the inside of the eyelids. There are a number of different causes of thrombocytopenia. Suppression of bone marrow by radiation is one cause. Chemicals, cancer, viruses, and sometimes we don't know what causes thrombocytopenia, in which case it's said to be idiopathic or the cause is unknown. The first bleeding disorder was thrombocytopenia. The second is hemophilia. Again, it is a clotting disorder. There are several different types. One of the 12 fibrin clotting factors is absent in each case. The fibrin clot formation is impaired and bleeding occurs. The most common is lack of factor VIII, known as classic hemophilia. This is a sex-linked recessive, and it's more common in males than in females. One sign or symptom is ecchymosis, which means bruising and swelling of the joints. This slide and the next two show you examples of bruising or ecchymosis. This shows you ecchymosis on the trunk. This is periorbital ecchymosis. This is an injection hematoma and is not uncommon in people who have hemophilia. A hematoma is an abnormal collection of blood outside of a blood vessel. The blood has leaked into the tissues where it does not belong. Sometimes blood leaks into the joints. The result is the joints will swell and there is excruciating pain. The best treatment for this is, if the joint is swollen, lift them up higher than the head. If you have hemophilia, it's important that you be very cautious and try to avoid bruising. The treatment for hemophilia is plasma transfusions of the clotting factor. With these transfusions, there is an increased risk of contracting AIDS and hepatitis B, and the reason is these individuals receive clotting factor from 50 different donors. There's not enough clotting factor in the blood from one donor, and so they have to take 50 different donors and spin the blood down, remove the clotting factor, combine it, and give it to these individuals. So they're at increased risk for these two disorders. I mentioned that hemophilia is a sex-linked recessive and therefore more common in males. The mother is a carrier and the father is normal with respect to this gene. Half of the offspring are likely to be normal for this condition. 1 of 4 is likely to be a daughter who is a carrier, and 1 of 4 is likely to be a son with hemophilia.